Hello, good day, Mrs. Mary Grace Obdulia O. Amok, RN. My name is Joshua Go from Bachelor of Science in Nursing, SN3. I am here going to return demonstrate the nasogastric tube intubation and feeding. So, number one, okay, we have to define what is this. Nasogastric tube intubation, it refers to the insertion of the nasogastric tube through the one of the nostrils down to the nasopharynx and into the alimentary tract of the patient or you or the patient itself. A feeding tube, which is a medical device we use that to provide the nutrition of the patient who cannot obtain nutrition by swallowing. It is also the state of being fed by the feeding tube is called enteral feeding or tube feeding. Number one, let's to begin with the inserting, how to insert the nasogastric tube. Now, the purposes of this procedure is to administer tube feedings and medications to the clients who are unable to eat by mouth or by swallowing sufficient diet for the patient without aspiring food or fluids into the lungs. To make sure also to establish the means of suctioning stomach to contents to prevent the gastric distension, nausea, and vomiting. Also to remove the stomach contents for the laboratory analysis, to lavage or to wash the stomach in case of positioning or overdose of medications.
So for the materials that you are needed in this procedure are, you need a nasogastric tube which is appropriately from sizes 8 to just 8 to 18 French, and then you need a stethoscope, and then a normal saline solution, okay, and also a bath towel for the patient not to be getting wet. You also need some tissues, and then a septovalve syringe or the Tumi syringe. Then you have your disposable gloves, safety pins, and rubber and band clamp if you have so, for the clipping of the tube, and then tape for 1 inch or wider. Okay, so after you also a water soluble lubricant, you also need that one for the insertion of the tube, a water soluble lubricant, and then a medicine basin or the kidney basin, and then a tongue blade or a tongue depressor. You need the tongue blade or the tongue. This is optional. Flashlight also optional, or the flashlight tissues for able to see the tube. And then suction apparatus if you have so, which is electric for irrigation only. Small basin filled with ice. This is optional, or warm water, and glass of water with straw for the patient to have take a small sip before inserting if the gag is functioning.
So, as a nurse, following the basic guidelines of the nursing process, assessment, planning, implementation, evaluation, and documentation. So, for your assessment, you're going to assess for a doctor's order, an insertion of nasogastric tube, and then check for the history of nasal surgery or deviate septum, assess for patency of the nares, and then also ask the client if he or she is hyperextended the head, can do that one, and using a flashlight to observe the intactness of the tissue or the nostrils, including any irritations or abrasions. Examine the nares for any obstruction or deformities by asking the client to breathe through the one of the nostrils, okay, and that has greater airflow. And then also select the nostrils that has a greater airflow and determine the presence of gag reflex. The client can do that, can be gag reflex. Assess the mental status or ability to cooperate with the procedure. And then for your planning, you're going to plan before inserting the nasogastric tube to determine the size of the tube to be inserted and whether the tube is to attach or to suction. And then gather equipment and materials.
So for the procedure proper, the implementation of proper feeding, the inserting the nasogastric tube, make sure to introduce yourself and verify if that is the correct clients, and identify the client's identity. Explain the client what you are going to do, why it is necessary, and how he or she can cooperate. And then perform hand hygiene. Make sure to observe other appropriate infection control procedure to avoid cross-contamination. And then gather your equipment to help save time, effort, and energy. Make sure also to provide clients privacy to gain your trust and to avoid the client being shy with public. And then, if the nasogastric tube is rubber, make sure to place it in a basin with ice for 5 to 10 minutes. Or place the plastic tube in a basin of warm water. That's why we have that in our materials and equipment. And then after that, if the nasogastric tube is already being or good, or you have already soaked it with water and ice, make sure to assist the client in a high Fowler's position and drape his chest or her chest with bath towel or disposable pad to avoid being wet or spill the water if you feed the client. And then have the emesis basin and tissue handy, make sure available all the time. And then make sure also to don gloves or don disposable gloves to avoid cross contamination and to protect yourselves also. And then make sure to determine how far to insert the tube in the client by measuring the distance of the tube by placing the tip of the tube from the tip of the client's nose. After you have measured, make sure to extend the tip of the earlobe and then to the sipod process. Then mark this length with a tape, with adhesive tape, if the tube does not have markings. Okay, now you can now insert the tube after you have done the markings. By inserting the tube, make sure to put some lubrication first before inserting the tube. So now lubricate the tip of the tube with water soluble lubricant from 10 to 20 centimeters. Make sure that it is approximately same as 4 to 8 inches. Okay. Now I'm putting the lubric tube in my gloves. Before inserting the tube with its natural curve to the client, the selected nostril. Ask the client to hyperextend the neck, okay, and gently advance the tube toward the nasopharynx. The client may gag when the tube reaches the pharynx. Direct the tube along the floor of the nostrils toward the ear on that side. Slight pressure and a twisting motion are sometimes required to pass the tube into the nasopharynx of the patient. Some clients' eyes may water at this point. If the tube needs resistance, if there's a resistance, withdraw and relubricate it and insert into the other part of the nostrils of the oropharynx. Now the client will feel tube in the throat and may gag the ledge. Ask the client to tilt and head forward and encourage the client to drink and swallow. That's why you have the water and the straw for the client to drink and swallow. Okay. If the client gags, stop passing the tube momentarily. Have the clients rest, take a few breaths, and take a sips of water to calm the gag reflex. Okay. Now I'm thinking the client. In cooperation with the client, pass the tube 5 to 10 centimeters or equivalent to 2 to 4 inches with each swallow until the indicated length is inserted. And then, if the client continues to gag and the tube does not advance it with each swallow, withdraw it slightly and inspect the throat by looking through the mouth using a flashlight. Okay. And then, after that, you have to discontinue the procedure and remove the tube if there are signs of distress, such as gasping, coughing, cyanosis, okay, and inability to speak or hum. And then ascertain the correct placement of the tube by attaching the syringe to the end of the tube and aspirate 10 to 20 ml of stomach contents and measure the pH aspirated the fluids. Almost all the nasogastric tubes are radiopaque and a position can be confirmed through an X-ray. Place a test. After that, you can place now a stethoscope over the client's epigastrium and inject 10 to 30 ml of air into the tube while listening for a gurgling sounds. And then secure the tube by tapping it to the bridge of the client's nose. If the client has oily skin, make sure to wipe the nose first with water to defat the skin. And then make sure also to cut 7.5 cm, 3 inches of tape. Okay. Split it lengthwise at the end of leaving 2.5 centimeters, 1 inch tab at the end. Place the tape over the bridge of the client's nose and bring the split ends either around the tubing or under the tubing and back it up over the nose. Once correct position has been determined, attach the tube to a suction source or feeding apparatus as ordered or clamp at the end of the tubing. Secure the tube to the client's gown. Attach a piece of adhesive tape to the tube and pin it to the tape to the gown. Wash hands, remove all equipment, and make client comfortable. Establish a plan for providing a daily nasogastric tube care. Make sure also to inspect the nostrils for any discharges, irritation. Clean the nostrils and tube with moistened cotton tip applicators. Make sure to change the adhesive tape as required always. And then also to make sure give frequent mouth care.
And we're going to evaluate for our evaluation to conduct an accurate follow-up such as degree of client comfort, client tolerance of the nasogastric tubes, correct placement of the nasogastric tube in the stomach, client understand of the restriction and color of amount of the gastric contents which is attached to the suction or stomach contents aspirated. And then for the documentation, make sure to record or to document the relevant information for the insertion of the tube, the means by which correct placement was determined, and the client's responses. And then also document the type of inserted, date and time of the tube inserted, type of the suction used, color and amount of gastric contents, and client's tolerance of the procedure.